how do I summarize this in 2 minutes?
Yeah,
I think it's just, I think that's the main problem. It all started from a charity donation we had made to the islands. At the time, PPE gear was extortionarily expensive around the world. And and going to the islands, often they're faced with the choice of food or masks. So at the beginning, we literally just donated masks across to the island. And that kind of sparked a chain reaction of, what else can you procure and bring into the country to help the everyday citizen. And that's when All Health Clinical was founded. As we were helping digitize the hospital, that's when we had discovered that there was about 6 months worth of MRI scans that had been taken. And there wasn't really a lot of specialists left in the country to do anything about it. And when I spoke with the director at the hospital, he said, yeah, it's a common occurrence because in that world, to move up is to move out. Nobody really stays in the country. They can get much better pay moving to Australia and New Zealand and have a much better quality of life. So talent retention was incredibly difficult. And then we thought, well, how do we tackle this problem? People have sickness, people are dying, talent is leaving the country. We thought about getting human capital, so more doctors in the country, but how do we incentivize that? It's the same reason doctors leave to begin with. That's when I spoke to Blair at SupaHuman, and we talked about how AI could assist with this type of problem. And as we got down into the details, we discovered that AI is really good at quantifying data. It can help us identify the issues really quickly, but after that, it couldn't really do much in terms of the treatment for the patient. So the idea came then where it was more of a hybrid approach, where we combined AI's ability to quantify data really quickly and then use that data and connect them with clinicians from around the world to provide local guidance to the doctors in the islands. In the first instance, that's what I'm hoping to achieve with AI, is that at the very least, we can quantify the issue. We know roughly how much it's going to take, or we just roughly know what kind of problems there are, so that we can then link the right specialists to help solve these problems. They really understand our purpose and what we're trying to build, so we don't have to kind of explain more. There's a lot of initiatives and instincts that SupaHuman has, so it's just been really, really easy to deal with SupaHuman. Honestly, it's just creating a platform where we can't solve every problem, but if at least we can identify them, I think that would be a really, really good start. Any startups is quite a terrifying journey, but having a team of experts behind my back, really gives me the confidence to go out and tell the world that we can do something.